Hello everyone, in today's animated video, I will be taking you through an exciting lecture on ocular tumor, exploring the different types and the various management options available. Ocular tumors can be defined as a collection of cells that grow and multiply abnormally and form masses. These can appear on the eyelid, in the eye and also in the orbit. Ocular tumor can be classified into epibulbar tumor and intraocular tumor. Examples of epibulbar tumor are congenital tumor, benign tumor and malignant tumor. Under the congenital tumor we have dermoid and dermalipoma, while benign tumor examples includes conjunctival nevus, conjunctival papilloma and conjunctival epithelial melanosis. While of malignant tumor we have squamous cell carcinoma and malignant melanoma. In my next video I will be discussing on intraocular tumor. All these tumors may be benign or malignant. Epibulbar tumor involve the structure around the eye. Example the conjunctiva, while the intraocular tumor involve any structure within the eye. I will be discussing on the various types of the epibulbar tumor. The first example of epibulbar tumor is congenital tumor. Congenital tumor, they are not true tumors but choristomas, which is a mass of histologically normal tissue in an abnormal location. This congenital tumor includes dermoid and dermalipoma. Dermoid, an example of congenital tumor. Dermoid is a congenital tumor and consists of epidermoid epithelium containing sebaceous glands and hairs. It is mostly located at the limbus. It presents as yellowish, soft conjunctival mass in early childhood. Here is a picture of a patient having a dermoid at the limbus. Treatment option includes simple excision if the tumor is small in size, or lamellar keratosclerotomy may be required if the tumor is large in size. Another second example of congenital tumor is the dermalipoma. It is a congenital tumor and consists of fibrous tissue and fat, fibrofatty tumor. It is commonly located at the outer canthus, and it presents as soft, yellowish subconjunctival mass in adult life. Here are the pictures of patients with dermalipoma located at the outer canthus. Note that treatment is generally avoided due to the possibility of complication. Second example of epibulbar tumor is benign tumor. Benign tumors do not invade nearby tissue or spread to other parts of the body, but they can be serious if they press on vital structures such as blood vessels or nerves. Examples of benign tumor includes conjunctival nevus and conjunctival papilloma. First example of benign tumor is the conjunctival nevus. It presents as elevated pigmented nodule in the conjunctival. It typically appears on the bulbar conjunctiva, most often near the limbus. It can also occur in the caruncle and plica semilunaris. Note that nevi are mobile over underlying sclera. Here are pictures of conjunctival nevus at different location. Treatment option includes simple excision, which is performed for cosmetic purposes or on suspicion of malignancy. Second example of benign tumor is the conjunctival papilloma. It is sessile or pedunculated and strongly associated with human papillomavirus, especially type 6 and 11. It is located at the limbus, near canthus or in the fornices. Here are pictures of conjunctival papilloma at different location. Treatment includes excision, which is performed with cryotherapy at the base and surrounding area. Note that recurrence rate is high. The third example is conjunctival epithelial melanosis. It occurs due to the presence of excess melanin epithelial melanocytes in conjunctival basal layer. It is more common in darker-skinned individuals. Patchy flat brownish pigmentation of conjunctiva. Here are the pictures of conjunctival epithelial melanosis. No treatment is required as it has no malignant potential. Another third example of epibulbar tumor is malignant tumor. Note that malignant tumor are rare but serious neoplasms that originate from the conjunctiva. Example of malignant tumor includes: first is the squamous cell carcinoma, while the second example is the malignant melanoma. Squamous cell carcinoma, an example of malignant tumor. It originates from the epithelial cells of the conjunctiva. It often appears as a fleshy, gelatinous and elevated lesion with feeder vessel. It chiefly occurs at the limbus, especially nasal, and the lid margin. Here is the image of squamous cell carcinoma. It is treated by excision with cryotherapy of base. If recurrence takes place, enucleation or even exenteration may be necessary along with radiotherapy. Second example of malignant tumor is the malignant melanoma. It is rare and usually pigmented. It occurs typically at the limbus or close to the limbus and spreads over the surface of the globe. It has high risk of local recurrence and metastasis, especially to regional lymph nodes and lungs. Here are pictures of malignant melanoma at different locations in the eye. Management may require excision with cryotherapy and sometimes adjuvant radiotherapy and chemotherapy. In my next video I will be discussing on the intraocular tumor. Thank you so much for watching.